So you might be wondering who Health Sciences University are and what we do. So I'm just going to go through it very quickly. So we started life, I think, in the 1960s as the first chiropractic college within Europe. And over the last 10 years, we have strategically followed a project to basically diversify our academic footprint and the professions that we train students in. So up on the slide there, you can see where we've diversified and all of the different subjects and professions that we now support. Alongside that, we have also diversified our geographical location. So last August, we merged with the University College of Osteopathy in central London, which not only gave us more brilliant researchers to work with, it also gave us a London campus and all of the opportunities and benefits that come along with that, and it added osteopathy to our portfolio as well. So over the last 12 to 18 months, we have been working on a series of research narratives to describe the areas of research that we do and that we wish to excel at and the impact that we want to have. So the first of those is improving the health, well-being and quality of life of current and future generations. And our research there really falls into two camps. The first of those is around musculoskeletal health and care and pain management, so living with chronic pain. So Andy Dean mentioned earlier how those two tend to go hand in hand. So that's our first theme, and Professor Stephen Vogel's with us today, who does a lot of work on the MSK area. The second area within that is preventative healthcare, and we are currently in the process of setting up a new research centre within that area, and that's going to pull together our expertise in a range of different professions and disciplines, but including nutrition, public health, health promotion, early interventions, etc. So that's our first narrative. The second one is around enhancing human performance and functioning. So this is wider than just healthcare, but of course it also has a healthcare strand. So all of the different themes are up there. You can see that healthcare and medical professionals is within that, as is physical activity and human functioning. And then our third area is around innovating for excellence in healthcare and health sciences. A lot of this is led by our excellent Centre for Workforce and Systems Innovation, and Dr. Michelle Holmes is in the audience today, who's a member of that centre, so if you've got any questions, go and see Michelle. But that's really around workforce development. That could be retention, it could be career development, roles, etc. And we've also got some cross-cutting themes, so these are embedded across all of our structures, and they are around excellence and innovation in pedagogy, interventions, treatment, clinical practice, research methodology, etc. So I hope that gives you a quick flavour of who we are and what we're about. I will hand over to Neil now, who's going to talk about really what is the jewel in our crown, and that's our clinic. So we're quite unusual in the higher education space in that we have on-site CQC registered clinics. So Neil.
My name is Neil, and I was a physiotherapist still am, in the NHS for 27 years before I moved over to Health Sciences University. My aim was, or my ask was, to set up and develop further the clinical provision within the university. There was already a large chiropractic student provision and some imaging in the form of MRI and ultrasound. And so what we've done over the last 2.5 years is built a number of services which you'll see up here. And we have co-produced and delivered with our NHS partners as well. So I'm still in practice on a Friday, so I am running an NHS list for Hampshire at the moment as part of their spinal service, is supporting their waiting list initiatives. We've also worked with Dorset in providing a lower limb triage service. We have over 55,000 patient contacts per year. As Julie said, we are CQC registered. We host a number of services such as our lymphedema service with Lewis Manning. We have NHS Dorset MSK service within us, and we also run student podiatry, student dietetic services, as well as offering consultant radiology interventions such as injections, and also a consultant surgeon providing outpatient appointments. So you can see we have a wide range, diversity of clinical services, which gives great patient experience, we hope, as well as student experiences. But from a research perspective, we've also, the other thing we have done is be part of the community diagnostic imaging program. We now have a CT scanner within our locality, which again proves that our relationships with the NHS are really, really strong, and it gives a great opportunity from our radiography students to have placements on site. So having placements on site is such an advantage for us, and it's such an advantage for our students, but also our community. We can offer low cost or free care in a separate service outside their NHS pathway. We offer clinicians that have come to work with me are all ex-NHS and many of the colleagues of mine. And essentially, the university gives those individuals a platform, and it's a platform to innovate their clinical thoughts and their clinical opinions into something tangible. And one of the first projects that we've just completed on is the sarcopenia project. And as I think it was being mentioned a couple of times about the effects of sarcopenia on the older generation, and it happens very early on, as you can see from some of that data. And what we basically gained was some support from Lisa and Julie, some funding to be able to offer 50 individuals a bespoke, very dynamic strength training program led from a multidisciplinary perspective, sports therapists, exercise instructors and physiotherapists, working with the community to build a structured strengthening program for individuals that might be at risk of falls. And we're just pulling some just basic data, which we hope will be a platform for my research colleagues. So essentially, we're clinicians working hopefully in a research-informed and an evidence-informed environment to hopefully give platforms for this type of work to be developed further. And you can see some very basic data that we've been able to gain from dynometry that gives some really nice outcomes. The second piece of work that we're involved in is essentially building support for nursing and rest homes. And we work with a company to develop some online content. Online content that we hope will be really interesting and for individuals to watch. These are warm-up and main events, as well as cool-down exercise sessions that we are testing at the moment with our rest and care home partners to see what sort of viability and feasibility for the users that could be found.
So just to finish up now, and after I've made you wait for such a long time, just to say that we are willing to use our clinics. They are open for research. We've just this week, for example, signed an agreement with the University of Leicester to be a research site for a large NIHR-funded clinical trial. So our site is there. As Neil said, we have over 50,000 patient visits a year. We can do diagnostic or treatment pathways. We've got strong PPI links. We've got PPI groups set up, etc. We can be a test bed. And we've got a huge breadth of professions and multidisciplinary expertise. So yeah, we're open to conversations about collaboration. Please do come and chat with us. And that is us. So thank you very much.